Before we begin, please know that some episodes include language that may be sensitive for some people. Welcome to another episode of The Birth Portal. My name is Connie. Today's true story is about a second-time mom I'll call Alice. Her first labor and birth was a normal one, with no complications, other than needing a little help with the vacuum when the baby was very low and Mom just ran out of steam. Her pushes were not quite strong enough, and the baby's heart was just beginning to show signs of needing to be born sooner rather than later. The sign I'm talking about is when we are monitoring the baby's heart using an electronic fetal monitor. With the electronic fetal monitor, we see when the mom is having a contraction and how long it lasts. A baby's heart rate is also picked up, showing how the heart responds before, during, and after a contraction. If, during a contraction, the baby's heart drops after the contraction is over, and the baby's heart is slow to return to its baseline, somewhere between 110 and 160, and we see this pattern consistently, the baby is raising a red flag. We had a quick discussion about calling the doctor to come and possibly needing to help her with the vacuum, which is a small cap placed over the baby's head at the back towards the top. And Mom would push as the doctor pulls. Alice cuts me off and says, "Go get the doctor now, please." The doctor came and helped the baby with the vacuum, and with one contraction, the baby was born as it was so low. This time, Alice wanted to try a home birth. And we did a home visit at 36 weeks or a month before the due date. We dropped off the supplies and copies of her antenatal records. We assessed the home and planned where the birth would likely happen. We made sure we had access to working electrical outlets and discussed what the plans for childcare would be if we had to transfer to the hospital. About a month later, Alice went into labor spontaneously in the middle of the night. I had a student midwife with me at the time, and we made our way to Alice and Jim's place. Their child is asleep when we arrive. They have soft music playing and are burning candles. The smell of freshly baked chocolate chip cookies filled the room. "Wow, Alice, baking cookies in the middle of the night when you're in labor? That's impressive." "I needed to get my mind off the contraction," she said, and is suddenly hit with another one that stops her from talking as she grips the island in the kitchen, pushing the basket of cookies away. Strong scents can sometimes be offensive in labor. So before you eat or drink something in front of a laboring woman, ask her if it's okay, and to tell you if it becomes an issue for her, or she may bless you with the gift of vomit. When she is through this contraction, we head to the bedroom to check and see how dilated she is. Alice is well on her way and is 6 centimeters dilated and contracting every 3 to 5 minutes. We set up our equipment in the bedroom as Alice and Jim hang out in the kitchen enjoying the music and the ambiance of the candles. Soon after we set up, Alice says, "My water just broke and there's lots of blood." The student and I quickly go to listen to the baby's heart, as we always do when a woman's water breaks and we needed to assess how much blood there is. The baby's heart is fine, and we listen for several minutes, maintaining a normal baseline of in the 130s, with no decelerations at all. There clearly was blood-tinged fluid with the rupture, but no bleeding afterwards. We talk about keeping an eye on the bleeding, and if we see any frank bleeding, which is bright red bleeding, that is continuous even as a trickle, we would head into the hospital. About 30 minutes later, Alice says she felt a gush, and we see bright red blood fill a pad, and then it stopped. We listen to the baby's heart, and it's normal. "Alice, we need to transfer to the hospital by ambulance now, as I think perhaps the placenta has partially detached from the uterine wall. Your baby is fine for now, but we need to head in." I call 911, as well as the hospital labor and delivery unit to inform them of the situation. They called their mother to come to be with their sleeping child. I asked Dad to pack a bag for Alice. My student checks Alice's cervix, and she's still 6 centimeters dilated, and there's no more bleeding, and the heart rate remains normal. Then my student tried to start an IV on Alice, as I packed up the supplies I'll need to bring in the ambulance, as I expect we could deliver the baby on the way to the hospital. 20 minutes later, still no ambulance, so I call again. They're on their way, they tell me. My student wasn't able to start the IV after 2 attempts. I'm feeling quite nervous inside and trying to keep it together. Let me try, I say, and thankfully find a good vein and successfully start the IV. There was no further bleeding at the time and the baby's heart remained normal. We listened constantly. Alice's contractions slowed down a bit. Finally, 40 minutes after we called 911, they arrived. Dad followed behind in his vehicle, as did my student. Alice and I are in the ambulance, and the paramedics ask, "Do we need the bells and whistles going?" "Yes, let's go!" As we make our way to the hospital, I continually listen to the baby's heart and reassure Alice and say, "Your baby's heart is okay. You're doing great." Her body seemed to know to slow down the contractions. I called labor and delivery to update them. "We're ready and waiting," they said. Alice's contractions picked up again as we arrived to the hospital, and we wheeled her quickly through the halls and headed up to the 4th floor in the elevator. I prayed inside, "Please, baby, hang in there a couple more minutes. Don't come now." Alice reports she's having rectal pressure, and we see more bleeding. The doors to the labor and delivery unit open, and the team is ready to take over. As they wheel her into the closest room, the nurses and the resident doctor swoop in. The staff OB, Dr. Lightheart, walks up to me, putting her arm around my back and asks, "Are you okay?" I'll never forget her kindness. She was always so calm and cool-headed. Alice is moved from the stretcher to the bed, and she thinks she needs to push soon. We listen to the baby's heart, and the heart rate is normal, and the bleeding is not so severe, so she's encouraged to listen to her body. Dad and the student show up just in time. We stand at the sides of the bed. Dad is holding Alice's hand, and she lets out a huge cry of pain. The doctor checks to see if she's fully dilated and announces she sees the top of the baby's head. "I see dark hair. Give us a good push with the next contraction, Alice." Alice is pushing so well, the baby's head is soon visible even to Dad. It burns, says Alice. "It's normal, Alice. Your body is stretching beautifully. Touch your baby's head." As soon as she feels the baby, tears flow, even from me. "It's going to be okay." Her baby is born with a good lusty cry and is placed on Mom's chest. I grab a soft, warm blanket to dry the baby off, turning her head towards Mom and Dad's sobbing eyes. Look at her. She's so alert and pink. I listen to her heart and lungs and say, "She's perfect." Within 15 minutes of the birth, we all step out of the room so the family can have some privacy. The doctors, nurses, my student and I debrief. Thankfully, with a wonderful outcome. I got to taste those chocolate chip cookies the next day after she was discharged from the hospital, and we debriefed with both Alice and Jim about the events and actions taken. Thank you for joining me for another episode of The Birth Portal.